Welcome to Focus on Abilities, a program about issues affecting the lives of people with disabilities. I'm Lex Frieden. I'll be your host for today's program, and we have a great subject to discuss today and a wonderful guest with which to discuss that subject. But before I introduce the topic and our guest, I want to ask you a question, one that we'll answer before the end of today's program, one very important to you, and it pertains to the subject matter: what law protects the privacy of your personal health information? We'll get to that in a minute, but first I want to introduce our guest. Today we're happy to have with us Dr. Kim Dunn from the University of Texas Health Science Center in Houston. Dr. Dunn, welcome to the program.
It's great to be here with you, Lex.
Now, on Focus on Abilities, we discuss a lot of issues that pertain to people with disabilities, chronic health conditions, and other complex medical needs. But today we're going to discuss a topic that really relates to the whole community, and everyone should have an interest in this subject matter: health information.
Right.
Why is health information important to me, to you, to everyone out there as an individual?
Well, I'm going to give you a couple answers. One, I'm going to talk to you as a physician, and I'm also going to talk to you as a patient and a family member of patients that have been very sick. Healthcare, the currency of healthcare is information. It has to do with getting information from the patient in terms of what their problem is, what their histories have been. It also deals with getting other information that helps us to make decisions about what is wrong with the patient and what to do with the patient. And that includes laboratory information. When you go and you get your blood taken, that goes into a laboratory, and it goes through a process that generates information that we use as doctors to make decisions about what to do to help patients with their health care. Radiology, imaging systems. That's another very important element in terms of being able to image, do CTs of the CAT scans of the head, echocardiograms, all kinds of things.
Just ordinary x-rays.
Just plain old x-rays, absolutely. So you have all kinds of information that we go out and get to try to understand what is causing a patient's problem.
Now, I'm sorry, but some people would say there's too much information. Every time I go to the doctor, I have to fill out the same information that I did the last doctor I went to.
Absolutely, and it's actually one of the biggest problems we have, because what we currently have in healthcare is you have, let's say, primary care. You go to your primary care doctor, and they do a certain amount of data collection, and they have their records. Maybe if you have to go to a cardiologist, they're going to have a whole set of process, and they're going to have their own processes and for managing information. And so you go to and it's very frustrating, I think, to patients, is why can't those doctors get their act together in terms of being able to connect all of those different areas of information that are part of your overall health record. And there is an emerging process now called health information exchanges. Back in they used to be called community health information networks, and they really didn't catch on because there wasn't enough pain in the system to really get demand that this could actually that you actually had to connect all of these locations.
Pain in the system, you mean
frustration.
The doctors weren't frustrated by it, so the patients had to suffer with repeating themselves every time they went to see them.
Right, because every time you go to another doctor's office, they ask you the same information, exactly. And your date of birth hasn't changed.
That's right.
Isn't that right? Has it changed?
Absolutely correct.
Right. So one of the things that we're in the process of, and this is nationally going on, in 2004, President Bush issued an executive order that said that by 2014, all Americans should have an electronic medical record. Mm-hmm. Well, that's like going from point A to point B, and somewhere in there a miracle happens. And so there is a lot of activity nationally and a great deal of activity at the state level and in our own community in terms of what we need to be doing to begin getting over the barriers to where you can connect the different sites so that you can begin sharing information across those silos in a protected way so that information doesn't have to be repeated It improves efficiency. We think it's going to improve efficiency, and by improving connection across these different sites, you'll be able to improve the quality of care.
Now, I guess you've made a good point, and that is that in order to provide good care, physicians and other healthcare providers need to have good information.
Right.
And I think I've made a good point in the sense that patients too frequently have to repeat themselves. But in between, there's an interesting dilemma, too. And that is that while I can remember my birth date, I may not be able to remember all the medication that I'm taking.
Right.
If I can even remember the names of the pills, I probably don't remember how often or what amount I'm supposed to be taking or do take. And so the information that I provide one healthcare provider may be different or inconsistent with that I provide another. And I certainly don't remember the results of my last blood test.
Right.
So what you've described is a system whereby we can record my vital health information and keep it up to date by providing with it, by adding to the database, the most recent information as well as historical information about my health, right?
Right. Now, there are a lot of challenges to go about actually making that a reality. One of the things that I always like to tell my students is that there is nothing magic about a computer. Because the original definition of a computer is one who computes. And we tend to try to make the solution a technical solution, and it's really not. It's a communication problem in terms of what are the standards of performance for communicating information. It's my belief that it would be very difficult to make all of those silos work together, because I really believe that you really have to have a trusted partner in co-managing health, not only your health, but also your information management.
Well, let me go back a second.
Sure.
You've described a system that will be in place by 2014 that is electronic in nature. It's your medical record, maybe on a chip or in a database somewhere, right? Except each one of the clinics and hospitals that I've been to recently are in the process of putting together such an electronic medical record.
Right.
And they're not using the same format and necessarily the same system. So how's that going to work?
Well, there are, to do effective automation, people and then effective processes for communication, and then you want to automate those components that are going to support communication and going to support key elements for making sure that the systems can talk to each other.
Okay.
The reality is, if you take an outstanding delivery system, they are trying to, a hospital system, they want to integrate with their physicians, and they are making certain technology solutions available so that they can talk to each other.
Okay.
And then you have the issue of how do you get data out of a system and into a system to where in the core term is called interoperability. Okay. And so one of the things that you have to think about how to go about doing that, but there are models for how this has been done in other industries.
Okay, so in other words, we have one hospital with one system,
right,
and another one with another, and in between we'll have a translation program.
Right, sort of a middleware kind of a model.
That's what you're calling interoperability.
Correct. But in order to, and think about, even 15 years ago, you had to go inside the bank to get money,
right,
and ATM machines. Okay, so that is one thing where banks had different systems, but they were able to come together because there was a business model that made sense for them to be able to offer that. And just think how that has really revolutionized how people interact with the banking system.
Right. So in the future, you think people will be able to go to the doctor's office and have pull up their updated health record before they leave, take it with them on a piece of paper, or again, just download it on a little chip like you carry in your pocket?
Right. One of the things that we're actually doing at the School of Health Information Sciences is to actually begin modeling what this should look like across the different silos of care. And it's called the HealthQuilt project. And QUILT stands for Quality and Interoperability Laboratory for Training. And one of the things we're going to be doing is to get about 50 physicians, primary care sites or nurse practitioners, places that patients designate as their health home, and then start looking from those particular sites how the information should be organized around their health home. Because I think one of the key things we need to be doing is really organizing systems of care and the information that is there to support that system in ways that will make sense for the patients and what their network of doctors are to support communication.
Well, another thing that we've talked about at the School of Health Information Sciences
Right.
from time to time is the notion of e-health, of
Yes.
electronic medicine, of telemedicine,
Right.
Of medicine at home, of
Right.
medicine away from the clinic, away
Right.
from the hospital, away from the medical center,
Right.
medicine where you are, where you want to be.
Exactly.
And I guess the electronic health information is a vital part of that new paradigm.
Yes, it is. And telemedicine itself has been around for a very long time. But actually getting telemedicine into practice has really been a transition because it's not taught in medical school or nursing school. And when I was down at UTMB and we were really experimenting with how to make this work in the prison system, it really was not about the technology. It was really about the training and about the processes to incorporate distributed telemedicine practice into the fabric of clinical care.
Well, that's interesting, too, because
Right.
Over the last 15 years, I've seen a lot of demonstrations of telemedicine.
Mm-hmm.
But there are more demonstrations of fantastic technologies which may actually not even be necessary
Right.
to practice effective
Right.
medicine in the home, so to speak.
Right. Technology is no longer the problem. There are really two key issues to make this a part, these kinds of really important technologies to support communication. Mm-hmm. One is actually embedding it into the workflow of how doctors, nurses, and patients want to receive care. Mm-hmm. The second is really getting it so that it's sustainable so that doctors, nurses can actually be paid for those type of services.
Well, I guess one of the issues for a physician might be what's appropriate to do over the telephone or
Right.
over the distance learning
Right.
mechanism,
Right.
and what needs to be done in a setting where you can actually lay hands on, as they say.
Right, and the key thing there is when you talk about telemedicine, it has a very broad spectrum. We use it all the time now in healthcare. It's called the telephone.
Sure.
But we really don't use it very efficiently, if you really think about it. Mm-hmm. And so you've got email,
Right.
okay, the telephone,
Right.
you have telemonitoring,
And in
where
the future, we'll have webcams.
webcams, live interactive video.
Okay.
So you have a whole spectrum of technologies, and the real key thing is really figuring out which ones are appropriate for which clinical conditions.
Okay.
And a lot of those things have actually been figured out in research and demonstration projects that have been either grant funded or funded by hospitals or organizations to try to figure those out.
We'll talk more
Right.
about how to do that in practice and what you and I as patients should expect in the future, how we need to be prepared to initiate
Right.
health information strategies in telehealth.
Okay.
After we take this break from Focus
Okay.
on Abilities. Thank you all for watching. We'll be right back. Stay tuned. Welcome back to Focus on Abilities, and thank you for staying tuned. I'm Lex Frieden, your host, and today we have a special guest, Dr. Kim Dunn from the University of Texas Health Science Center, School of Health Information Sciences. We're talking about health information, why it's important to you, why it's important to doctors, why we need health information, and how to take care of it. Dr. Dunn, one thing that we've talked about has to do with the need for physicians to have health information, but it's also important for us as people with disabilities, as patients, everyone really, to have a good health record.
Yes.
And I think it's really it's in our best interest to be able to have with us in any time necessary our health histories, and to be able to update anybody who might be giving us care, our health history and our conditions. How should people best do that? How can we do that?
Well, paper's a pretty good technology. I think that the easiest way is to get a binder, okay, and actually just every time you go to a physician or a hospital, you have a right to request that information. They may charge you, okay, a little bit for getting it, but it really is in your best interest to establish a discipline for requesting that information from there.
So if, for example, you're hospitalized for any reason, you should probably ask the doctor before you're discharged if you can have a copy of your medical record.
Right. The key thing that you want from a hospitalization is called the discharge summary. That is really the one thing that you would really want to, because in a hospitalization, you're going to have a very big file, and that may not really be all of that. There's a whole bunch of information in there that you really don't need. But the discharge summary from a hospitalization is really a very important thing to get, because it'll summarize all of the pertinent information for your personal network that takes care of you. Okay. One of the things that you can, so you can actually put in sections in terms of hospital records, physician notes, laboratory information, and some of the other things that I talked about. But it really is just an issue of getting in the habit of asking for it. Okay. Because again, you know, people, process, and then automation. There are services out there where they're called personal health records, where you can actually put the information online. And there's a wide variety of a very wide spectrum of the types of technologies that are available.
Are there any like free ones on the web?
There are some. Some of them are good, and some of them are I wouldn't recommend them. Okay. But we could actually, at the school, we're in the process of putting together some resources for the community in terms of what could be useful. So, and it'll probably take about a month or so before we get that together. But there are
we'll have that on
some
the
tools.
Website, right?
Yes, we sure will. And so, but it really has to do with a really knowing that you have a right to that information and the discipline to get that information.
Well, I mean, I know my own personal experience. You go to a physician, they take a blood test, the results are sent to the physician, they're not sent to you.
Right.
But if you ask the physician, would they please send you the results of that test, they will do that.
Right, and I think a lot of the large hospital systems in town are now developing patient portals so that patients will be able to have access to that information. And that is a very big step, I think, for our community and for patients. But again, it's going to take time to get that there. And in that interim, it really, just like patients really have to assume responsibility for their personal prevention plans and their personal, making sure they take their medications or do what is prescribed, you have to look at information management in that same context and take the responsibility for getting that. And doctors, if you get the official medical records from places, you will find very appreciative doctors because they're going to appreciate that you have that available.
Now, that leads me to a question that I think a lot of people are they're embarrassed to ask to see their charts. Can a patient look at their chart when they're in the hospital?
They have a right, absolutely.
Sometimes the nurses, I've noticed, treat those like they're sort of...
Well, the thing is, and I want to kind of put on my doctor hat here, and one of the things that, because I have a private practice, and some of my patients, they don't really want to know everything that I'm documenting and putting in there, because sometimes as a doctor, a patient will come with a problem, and it's my job to think of the worst case scenarios, okay? And I tend to, and most doctors, when they write down their notes, it's really as a way to write down what they're thinking at the time. And some patients want to know, and other patients are just like, I don't want to know what you're thinking.
Just fix me.
Just fix me. And so there's not really a one-size-fits-all that's really going to be appropriate. So I think that the key thing, the take-home is to assume that responsibility for your information management.
But the bottom line is patients have a right to their own information.
Absolutely.
Not only that, they should feel responsible for it, keep track of it, and have a good personal health record.
Right.
And a personal health record would include health history, listing of medications, listing of tests, and any other kinds of prescriptions or advice that healthcare givers may have offered.
And also the other thing that is, I think, important also is the sort of the personal health tracking kinds of things. Like, for instance, I'm a little overweight, and I really have set out a plan to start losing a little bit of weight. Well, you have to track that. If you want to lose weight, stop smoking, certain health goals, one of the most important things you can possibly do for yourself is to just, write it down on a piece of paper and just track it over time, because it does two things. It helps you see, what you're doing, and it also reminds you, and is a reminder to yourself to, I made some goals, so I need to try to, it's my responsibility to try to move forward on those.
Well, and there's another, it's in some respects I think it's obvious, but on the other hand, I don't think we do it with much discipline, but that is, if we find ourselves feeling bad after we eat sometimes, it's very valuable, and perhaps the most important thing we can do is to diary what we've eaten.
Absolutely.
And by looking at that diary over a period of time, a physician or other trained observer, advisor can tell us what's likely causing that upset. But most people don't do that.
Right. Well, the other thing, too, is with that is the way to actually, the most important thing you can do about losing weight is actually write down what you eat. Because people don't realize, what they eat. And just the discipline of writing it down, it's like, wait a minute, I better not do that. And so again, it has to do with information management, okay, and being able to have the discipline to document.
Now, you've said that the development of electronic health records, the further development of telemedicine, these are technologies and practices that are, in fact, in infancy. They're developing. And I think here in Houston, we're fortunate because we live in a place where they're going to develop more quickly. I mean, we are in the heart of development of some of these new technologies.
Yes.
And at the School of Health Information Sciences now, there will be a number of activities in the next few months and the next few years that will really establish the framework for use of telemedicine and e-health in the future. We're having a number of conferences, I know, and can you just describe the kinds of activities in general that we're about, that people can learn about and participate in?
Sure, absolutely. First of all, an upcoming conference is where we're going to look at what needs to happen in terms of making your personal health information available in the time of a disaster. And it's really applying lessons learned from Katrina Rita in terms of what we can actually go about doing to do that. The next major conference that's coming up after that, and it's where we're going to be getting the leaders for our local community, but in the other communities around Texas, and with the governor's office and with the national leaders from the Office of the National Coordinator out of HHS and CDC. And we're going to really put some very aggressive goals for our own community and for other communities around Texas in terms of where do we want to be a year from now, what are the barriers to achieve it, and what do we have to do to make that connectivity, interoperability, to make it easier for the doctors and the patients to share information in a private way across those silos of care. The website for that is nhit-shit.uth.tmc.edu. And I would really encourage anyone who has a particular interest in terms of policy development or has particular concerns is to go to that website, register, and come and be part of the solution for interoperability in healthcare.
The website, again, is
nhit-shit.uth.tmc.edu.
That's very good. And I'm sure people will make note of that. Dr. Dunn, the real key here is improving health through improving information, isn't it?
Absolutely.
And to do that, we have to have the cooperation of physicians, of clinics and hospitals, of other healthcare providers, and most importantly, I guess, patients.
Right.
As a person with a disability now, who experienced some upset. Actually, we lost our home in Tropical Storm Allison.
Right.
I think it's very important for us to, in times of disaster, have information that we can carry with us at a moment's notice. But it's also important for all of us in times that we get ill and don't expect it to be able to have health information that we can relate. And in the future, despite the current practice of repeating our birth date, name, and so forth, maybe we'll be able actually to use that information more efficiently to get straight to the front of the line without having to sit for 30 minutes and fill out paperwork, and actually improve the efficiency and effectiveness of healthcare.
I couldn't agree with you more. But it's going to take some time, because we're really changing a lot of processes in the healthcare system. And I think it's really important to really look at partnering with your health home, because I really believe that you have to have a point of coordination and care, not just for information management, but making sure that there's an advocate in your personal health care system that can make sure that things are coordinated in your personal delivery system.
And in most cases, that would be your primary care physician, your
Correct.
personal physician. Many of the people who are watching this program are Medicaid recipients. They depend on clinics. They can also depend on those clinics to help them with their personal information.
Well, in fact, we're working very closely with the Gateway to Care and the Harris County Healthcare Alliance to try to really look at what we need to be doing, particularly for the uninsured and underinsured, in terms of trying to link those sites together.
So this is an issue that affects everybody.
It affects everyone.
Matter who your caregiver is, your information is valuable.
Absolutely.
The law that I mentioned at the beginning of the program is HIPAA.
Right.
And if you don't know HIPAA, you should know HIPAA, because it gives you the right to be responsible for and to own your own personal health information, and it assures your privacy in doing so. We've discussed health information today on Focus on Abilities. I want to thank Dr. Kim Dunn for being my guest here today and for sharing with us a lot of information that involves care for us today, but also involves possibilities for the future.
Well, thanks for letting me come and share what I know.
Appreciate it very much. I want to thank all of you for watching Focus on Abilities. This program is for you. It's for people with disabilities and for everyone in our community to learn more about disability, about chronic conditions, about health care, and about living with opportunity in our community. My name is Lex Frieden. I'm your host. Please join us next time for more Focus on Abilities.